The spotlight has been on mental health for some time, even more so now because of the COVID-19 pandemic. We spoke about the need for more mental health care with the CEO of PrairieCare, Todd Archbold, in today's Newsmakers. Based on what you see, what is the need out there for mental health services for children?
Sure. We've been experiencing a mental health crisis for some time now that's really only been amplified by the pandemic. At PrairieCare, the pressure for services, the need for care has only increased in the last several months. Unfortunately, many people find themselves in a crisis and their entry point to get to services happens to be an emergency room. And we really need to focus more on prevention, education, and other ways to access care rather than finding yourself in a crisis first.
And why is going to an emergency room not the best solution?
It seems like kind of the last option for many families when they're in a crisis. It can be scary, it can be traumatic, it can be expensive as well. And we need to do more to identify issues up front, whether it's in schools, whether it's in primary care, to do our best to avoid those crises from happening and try to make progress towards healing and build that resiliency.
And you guys are doing that through several programs?
We are. We have about 10 locations throughout the Twin Cities, including Rochester and Mankato, including a large hospital in Brooklyn Park. We partner with all sorts of folks in the community, ranging from primary care to school districts, again, to try to get ahead of these things and really build awareness. And I do think that with the increased demand and stress that so many have been experiencing, we really are riding a wave of awareness today. Most of us have had conversations with friends and family in the last year about isolation, about depression, about feeling anxiety. I think it's important that we continue to talk about those things.
Any advice you have for parents if we know that our kid needs help? What should we do?
Sure. I think the advice is speak up early and often and talk to peers, talk to colleagues and friends, and seek professional help if you have any concerns about possible warning signs. Kids talking about wanting to hurt themselves or others, feeling anxious, lonely, and depressed are some of the key words that we always look for. And again, really to network and talk to the people around you, and don't be afraid to seek help through primary care or your general health care provider.
Sure. And to end on, you guys got some good news recently with the Omnibus Bill.
We did. Just yesterday, the Health and Human Services Omnibus Bill was signed into law, which is going to allow PrairieCare to expand 30 additional inpatient beds right here in Brooklyn Park, which will expand our capacity from 71 up to 101 beds, which we hope to have operational by the end of 2022, which is going to allow us to care for about another 1,000 kids per year who need psychiatric care.
Right, so I bet you guys let out a cheer when you heard about that.
We are. It's very exciting news. I feel as though we're responding to a call to action, and now the real work begins. Now it's time to find great, compassionate staff to help join us in this mission and care for the kids and families who need us.
All right, Todd Archbold, CEO of PrairieCare, thanks for being here today.
Thank you.
Find more local news stories at ccxmedia.org and follow us on social media.